Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Prime Minister Narendra Modi interacts with beneficiaries of PM street vendors Atmanirbhar and Nidhi, assures digital benefits to street vendors. Naga Tele-health launched in Nagaland. Health Minister S Pangnyu Phom says it will benefit all and provide quality and affordable healthcare services. Nagaland's COVID-19 tally climbs up to 4,375, and Health Ministry issues SOP for partial reopening of schools for class 9 to 12 from 21st September. Prime Minister Narendra Modi today said that there has been a lot of talks of the poor in our country, but the work done for the poor in the last 6 years is unprecedented. Every sector where the poor were in scarcity, the government schemes came as their enabler. The Prime Minister was addressing more than 1 lakh street vendors of Madhya Pradesh benefiting from PM Street Vendors Atmanirbhar Nidhi, PM Swanidhi scheme through video conferencing today. He said that the objective of this scheme is that they can start afresh, start their work again. For this, they get easy capital. This is also the first time that the network of millions of street vendors has been truly connected to the system. They have got an identity. Describing the benefits of Swanidhi scheme, Modi said that they can get rid of interest completely through the scheme. Under this scheme, interest rebates of up to 7% are already being given. But if some small things are taken care of, then they will not have to give that also, he said. Announcing to provide digital benefits to street vendors, the Prime Minister said that an online delivery facility is also being considered for street vendors. In a step towards making health and wellness services closer to the community, Nagaland today received its first Naga Tele-health, a telemedicine platform where citizens can directly connect with medical officers and specialist doctors and seek general and specialized tele-consultation at their doorstep free of cost. Health and Family Welfare Minister S Pangnyu Phom virtually launched the Naga Tele-health at his office chamber in Kohima. Minister Pangnyu, in his remarks, said the launch of telemedicine platform in the state will greatly benefit all, especially during the current pandemic situation, and cater the needs of those families and communities living in remote areas to have access to qualified doctors for general and specialist consultations. He also informed that this platform will be established in all health and wellness centers across the state through a hub and spoke model to reach the catchment population. The minister expressed confidence that such important initiative will ensure that quality, affordable healthcare services reach to every section of the society. Director Health Office, US8, Sankita Patel said, through the Naga Tele-health initiative, it will continue to provide quality care and holistic comprehensive healthcare services to the remote and unreached. She said strategic plan, execution and capacity building are foremost to continue to remain operational to ensure health services and also be prepared to manage future public health threats. The Naga Tele-health service will be launched in a phased manner. Currently, the services are rolled out in 82 sub-health centers, connecting medical officers at primary health centers and districts for general tele-consultation. The provision of referral and tele-consultation with specialist doctors with support from Christian Institute of Health Sciences and Research, Dimapur, are also available. The Naga Tele-health platform is being launched in web and Android platform. The Naga Tele-health is an initiative of the Nagaland government, supported by US8 Nishta Jaipeko to provide quality healthcare services at the Ayushman Bharat health and wellness centers in the state. In Nagaland, 130 positive cases of COVID-19 have been reported today, taking the total tally to 4,375. This is the highest COVID-19 case reported in the state after almost a gap of 3 weeks. Health and Family Welfare Minister S Pangnyu Phom in a tweet said 64 cases have been reported from Kohima, 63 in Dimapur, 2 in Mon and 1 from Magukchung. The state has now a total of 626 active cases, while 3,728 have recovered. This news comes to you from All India Radio, Kohima. Union Health Ministry has issued Standard Operating Procedure SOP for partial reopening of schools for classes 9 to 12 from 21st of this month on voluntary basis. disallowing of sharing of notebooks, pen and pencil, water bottle among students, prohibition of assemblies and sports, encouraging online learning, entry of asymptomatic persons are some of the important points of the guidelines. It said, however, written consent of the students' parents or guardians will be required, and such visits for teacher-student interactions must be organized in a staggered manner. Similarly, physical distancing shall also be maintained in staff rooms, office areas, including reception area and other places. The guidelines said all employees who are at higher risk, like older employees, pregnant employees, and employees who have underlying medical conditions, to take extra precautions. Pulse oximeter to check oxygen saturation levels of any symptomatic person must be arranged. According to the guidelines, entrants should have mandatory hand hygiene sanitizer dispenser and thermal screening provisions. A seating arrangement has to be made to ensure a distance of 6 feet between chairs and desks. The teaching faculty will ensure that they themselves and students wear masks throughout the conduct of the teaching. If there is cafeteria or mess facility within the premises, it shall remain closed. Concerned teaching and non-teaching employees up to 50% of the strength may be called to schools for online teaching or telecounseling and related works. Ministry of Women and Child Development is organizing a series of webinars during the third Pushan Ma being celebrated this month. The first webinar on best practices and success stories from Pushan Abhiyan was organized on 7th of this month. The second webinar was held yesterday on the topic of nutrient requirement for children and mothers during the first 1,000 days. The webinars were presided over by Women and Child Development Minister Smriti Irani. Addressing the webinars, Irani appreciated the efforts of the coordinating ministries and appealed to all to promote Jan Bhagidari in making all-out efforts to make the Pushan Abhiyan a success. She said her ministry plans to compile best practices and success stories into an e-book. Considering restrictions on the number of passengers due to the present COVID-19 pandemic, Deputy Commissioner Dimapur has fixed the fares of taxis and auto rickshaws to be followed in Dimapur with immediate effect. In an order, auto rickshaw having 3-seaters will ply with 1 passenger on hire basis on all routes with the present existing higher rate as per the new guidelines. The fares for auto rickshaw having 6-seaters plying from Railway Gate to Jumukidima have been fixed. The route from Railway Gate to Purana Bazaar has been fixed at 20 rupees, 40 rupees for Putam Bukuri, while 3rd and 4th mile at 50 rupees. The fare for 5th and 6th mile is 60 rupees, 7th mile at 80 rupees, Ura Peace Camp and Singrijan at 100 rupees each. Regional taxi fare from Jumukidima to Medzifema will be 90 rupees per passenger, with 3 passengers for Maruti Auto and van, while 5 passengers for Tata Sumo and Innova. Further, the taxi fare from Dimapur to other districts will be in accordance with the fare fixed by the respective regional transport authority. And now 20 news, here are the main points again. Prime Minister Narendra Modi interacts with beneficiaries of PM street vendors Atmanirbhar Nidhi, assures digital benefits to street vendors. Naga Tele-health launched in Nagaland. Health Minister S Pangnyu Phom says it will benefit all and provide quality and affordable healthcare services. Nagaland's COVID-19 tally climbs up to 4,375. And the Health Ministry issues SOP for partial reopening of schools for classes 9 to 12 from 21st September. That is all we have in this evening news bulletin. Good night.